Okay.
I had to fit this shirt on. I took it out because
Okay.
it's black.
Hmm?
Right? It has to be white if we're gonna.
If you wear it under your uniform, yeah.
Yes. Okay. And so you have now your the color of the chest wall. Like I said, you have to check the color anterior, lateral, and posterior. So you're just looking. So the color of the chest, the skin should approximate the rest of the body. It should be pinkish. Okay. You see the intercostal spaces. So if you look at the intercostal spaces here, all the way there, they're even and relaxed. You don't see any bulging, no retractions. Bulging is that way. Retraction is inwards. So if you have retractions, that means respiratory distress. Bulging may mean there is emphysema, or you have effusion, or subcutaneous emphysema, like I said earlier. Okay. Now check also the chest symmetry. The movement of the chest wall as the patient breathes in and out. So they should be symmetrical. Okay. Check the rib slope. So again, you'll notice that the ribs, they will go this way. And then, so it goes this way. And then here. So this is what we call the 90-degree angle, less than the 90-degree angle. So it's not going to be like this.
Is that all we have to do? That's what you just did when we checked?
Yeah, so you say that the rib slope, it's oriented downwards and it's less than 90 degrees. And then you now check the respiration pattern. The breathing, let's say, is about 14, relaxed. Rhythm is regular, unlabored. Okay, can you please put your index fingers together? Okay, so we're looking for the angle. This is less than, or this is 160 degrees. Otherwise, this is the Shamrath technique. Okay, this is to determine any hypoxia. Okay, through clubbing of the fingers. And then we assess the AP to lateral diameter. So in the AP to lateral diameter,
Can we stand?
no, that's fine. Can you just raise your okay, so you measure the diameter AP anterior to posterior. Okay, so this is about 20. Okay, this is just an approximation. You don't really need to be very specific. So this is about 20, 21. And then over here on the posterior aspect, okay, so here you will see it's about 47. So it's a 1:2 ratio. So you have 20 and about 47. This is even wider. So that's a normal finding. Okay. So like I said, if the patient is barrel chested, the chest would extend this way. So this will approximate this. Okay.
Makes more sense.
Okay, so we also check the shape and position of the sternum. So the sternum is this one. Check the position of the trachea. You will note that the sternum is at the level of the ribs. The trachea is in the midline. Okay, and then for the chest expansion, ask your patient, can you take a deep breath? Okay, so you will see the expansion of the chest wall. Okay, relax. That is about 3 inches. So it pushes forward, and that's about 3 inches.
Do you want us to talk through that and say, okay, you know, it's about 3 inches, we're good?
Yes.
Okay.
Which is the normal finding. Okay, and then we do the assessment. Oh, okay, so we do the palpation of the thorax. So when we palpate, again, posterior, lateral, anterior. When we do the palpation on the posterior aspect, we need to tell our patient, can you put your arms this way? Please stop texting, and then hands forward. Okay, so when you do the palpation on the posterior aspect, again, dime-sized motion, okay, along the intercostal spaces. Any pain? Okay.
So is that what we're palpating for pain?
You're palpating for pain. If there's any crepitus that you may feel. Okay.
And the crepitus feel like the hair.
Yes. So when you're doing this, that's how it will feel here. Oh yeah. Okay. So all the way. Does that feel good?
I
So
know.
you'll see.
You look like
He's like, please turn over.
My
Okay,
goodness.
so you'll see it goes this way, down, this way, down, this way. So you can, it's going to be more organized. Okay, so once you have reached the bottom, you now assess the lateral. So ask your patient, just raise your hand slightly. Okay, so here, okay,
It goes a little
and
bit.
then here. Okay, and then anteriorly, the patient's arms should still be raised and assess for crepitus and pain. Any tenderness?
No.
Oh no. I was just so concentrated on rubbing it.
So you always keep the breast area. So down. Okay. That is for sensation. Okay. So palpate for sensation. So normal findings. And then we do the vocal fremitus. So here, again, you start the patient. Can you please arms together, hunch, say 99.
99, 99, 99, 99, 99, 99, 99, 99, 99.
Okay, so you will when you feel the vibrations, this one here is going to be louder compared to the vibrations here. Okay, now again on the anterior aspect. Okay, so
99, 99, 99.
okay, here you will feel the vibrations. They're stronger compared to the vibrations here. Okay, so that's for the vocal fremitus. And then when we talk about the thoracic expansion, I'll start here. So just below the sternum, pinch the patient's skin, and then ask the patient, take a deep breath. See, look at my thumbs. See the movement? Okay, so there is that movement of the thumbs as the patient breathes in and out. And the thumb movement on both directions is symmetrical.
Okay, can you do that again?
And you do that on the front and the back, right?
Way to block off my
the
view.
skin.
It's gonna pass out.
And then at the posterior aspect, you do it by the T10, area of T10. So it's here. In females, you know where it is because you have the brass strap. Okay. So, okay, hunch forward. See the movement?
So you gotta really grab them kind of tight.
Yes. Okay. So this is the what do you call this? The thoracic expansion. So normal will be about 2 to 3 inches, both directions. Okay. And then we now do the percussion. So in percussion, again, okay, posterior, lateral, anterior, or you can do anterior, lateral, posterior. Does not matter as long as you cover the entire chest wall. So again, ask your patient, lean forward. Okay. So remember how to percuss. Okay, so if I stop here, I now ask the patient, can you please raise your hand? I now start here. Okay, and then we go to this side. I'll be the one to move it, so you're not hurt. Okay. Okay, and then anteriorly, start just below the clavicle. Skip the breast. Okay, so this is for percussion. And then we do the diaphragmatic excursion. This time it's just the back and it's going to be one side going down. This is where you will need your
Oh, it's the
tape.
tape, right?
What's it called? Something excursion?
Diaphragmatic.
Diaphragmatic.
Okay. So here you ask your patient, can you hunch forward? And then, can you please take a deep breath and hold it? Okay, so percuss until you hear a change in the tone. Okay, so over here, relax.
You actually heard a difference just now?
Yeah.
When I exhale out?
Said relax. Said relax.
Okay, so you're supposed to hear the change?
Yeah, you will hear the
Like you
change.
feel the change.
No,
No,
if you're
hear it.
percussing,
Oh, you
you will
hear it.
hear it.
Oh,
a different sound.
yeah, they hear
Did
it.
you hear? Okay. You have to
So,
pay attention.
Okay.
Okay.
Lower pitch.
So when you this area where you mark is the starting point of your percussion going up. This time you ask your patient, exhale, hold it. Okay, hold on. So again, this way going up. All right. Can you please exhale, hold. Okay. Okay. So relax. Relax. Okay. Measure. So
3 to 6, right?
Okay, what is the point of this?
this is the movement of the diaphragm. You're assessing the movement of the diaphragm. It's if it descends about 3 to 6 centimeters on both sides.
Okay.
Okay. So if you have like atelectasis again and all that, you will not see this 3 to 6 normal descent of the diaphragm.
Okay.
Okay, so here measure, okay, so that's about 5 centimeters, which is normal. Now do it on the right side, the same thing, mark it again. But you will note that when you mark it, commonly it will be like this, a little higher.
Because the liver.
Right?
Yes, because the liver pushes the diaphragm upwards. But the distance here will still be 3 to 6 centimeters.
Now, do you want us to actually do the right end again or tell you that?
No, when you're doing the actual skills exam, you have to do both sides.
Okay.
So they don't have to be equal though, right? The left and right?
No,
Like,
in terms of the
distance?
the distance, no.
So say
As
like
long
this
as-
was 5 and this was 4. This
That's
is
fine.
4.
It's still between the 3 to 6. Okay, and then you assess what you call this, your auscultate. So, like I said, you don't need to ask your patient, take a deep breath. We listen to the bronchial sounds over by the trachea. You will hear a different type of sound. Bronchovesicular will be here, just below the clavicle and between the scapula. Okay, and then down here is where you will hear the vesicular sounds. If your patient were more exposed, you will be able to appreciate the sounds, the difference in the sounds. But basically, when you listen to the trachea, the sound here will be different compared to the sounds here. Okay, so this is for assessment of the thorax and the lungs. Question?
So what does it sound like here? I've never put a stethoscope here.
You should.
I've never.
I'm gonna do when I get home.
Is it different on guys and girls?
No, it's
In the mirror.
it's not in men or